Hi everyone, this is the Urine Culture Lab. In this lab, you're going to learn about how clinical hospitals actually diagnose that someone has a urinary tract infection. So what they actually do with urine. And we're going to start off with some background about the urinary system. And then we're going to talk about what a UTI actually is and how you test for it in lab had you actually been doing the lab. I'm going to start with some background. So the urinary system includes kidneys, ureters, the bladder, and urethra. The kidneys, their function is to produce urine. Then the ureters carry the urine. So here are your two ureters. The bladder is where the urine is stored, and the urethra stores urine. And all of these things could get infected, but I want to talk a little bit about urine itself. So again, it's produced in the kidneys, carried by the ureters, stored in the bladder until it's released by the urethra. So urine, there's a lot of controversy about whether urine is sterile or not. The definition of sterile means that something has no bacteria in it at all, actually no microbes living in it. So I would say it's not exactly sterile, but it's pretty clean. It's pretty close to being sterile. The reason why urine is not sterile, I'm talking about from a healthy person, is because it has a small amount of the normal microbiota bacteria in it. So that's why urine is not considered sterile, but it's such a small amount and it's your normal microbiota that it is, I would say, pretty clean. So bacteria are present at very low levels in the urine of healthy people. And urine should look like this from healthy individuals. It should be transparent and not foggy. Anytime you see urine that has a smell like an odor, or it looks foggy or turbid, like if you were to carry it, that means that there is an infection, that there is organisms growing in there, usually bacteria that you have growing in there, and the bacteria are doing some sort of metabolism that makes it have an odor, as well as they're growing. That's why it looks turbid or cloudy. So anytime you see that, it means that it indicates an infection. And urinary tract infections are when bacteria infect part or all of the urinary system, which again, we talked about includes the kidneys, the ureters, the bladder, and the urethra. And infections of the lower tract, so in the lower urinary system, bladder infections are called cystitis. So itis is inflammation, cystitis is bladder infection. So here we have normal urinary system. Remember with infection in the immune system, we learned that inflammation happens. So here's inflammation happening in the bladder and it's infected. So again, bladder infection is called cystitis in science. Symptoms of bladder infections are painful, difficult urination, and we call that dysuria. So that's the symptoms if someone does have cystitis. Infections of the upper urinary system, so if you go up and the kidneys get infected, we call that pyelonephritis. And symptoms of that include fever, chills, back pain that comes and goes. So with both cystitis and pyelonephritis, we're focusing on bacteria that have gotten to the bladder when they shouldn't be. That's cystitis. And then a symptom of that is dysuria, which is also a symptom of kidney infection or pyelonephritis. And so when you see bacteria going up here, this is not good. So urinary tract infections can come from two main sources. The main source that urinary tract infections come from are the patient's own microbiota. So we have microbiota, we have our own bacteria in us, but they should stay in their location. If they go somewhere where they're not, they could cause an infection, a UTI. So if patients' feces or tissues surrounding the urethral opening have organisms in them and they get into the urethra, then you can get an infection, UTI. So that's the patient's own microbiota. That's why hygiene is super important with UTI. So if someone makes sure that they're hygienic, they're clean, this is one way to avoid UTIs. Another reason that people get UTIs is the spread of a systemic infection to the kidneys via the bloodstream. So a lot of times you might have some different infection that has nothing to do with the kidneys, but the bacteria can cross over to the kidneys. So that is how another way that you can get UTIs. And also with the patient's own microbiota, it can quickly spread. So a UTI can be like a mild UTI and quickly become a bad UTI and a kidney infection, which is pyelonephritis, because the bacteria can start traveling up. But I want everyone to keep in mind that the most common UTI source is the patient's own microbiota, and then the other one is an infection that comes to the kidneys by the bloodstream. There are certain things that make someone more at risk for getting a urinary tract infection, and we call these risk factors. So the risk factors for UTIs, one of the main risk factor is anatomy. So being a woman, so women are innately more prone to UTIs than men are because of the anatomy. So in females, the urethra and anal openings are close to each other, and the urethra is very short. So it's easier for bacteria to travel up before getting flushed out by a person urinating as compared to a male. So that's why women in general have higher UTIs than men, because of the urethra being short and close to anal openings. Another risk factor is patients with catheters. So catheters are these tubes that are, they can be put in patients for various reasons, but a lot of times when people have surgery or a woman gives birth or anything, a catheter is put in them because maybe they've had so much anesthesia that you don't want them getting up to go to the bathroom. And it's this tube that you put in someone's urinary system so that they can empty urine in a bag and they don't actually have to go to the bathroom. And some people live with catheters, many different reasons. Anyway, patients with catheters are at high risk for UTIs because bacteria can grow on the walls of these catheters and in bad situations form biofilms or communities of bacteria that cause bad infection. A lot of times patients actually that get catheters will on the side inherently be taking antibiotics because the doctor wants to avoid them getting antibiotics. And then patients with neurological compromise to the bladder. So any neurological disorder that makes it hard for someone to know that they need to go urinate will make you more prone for UTI. Then with enlarged prostates, so in the male anatomy, men have a prostate. If prostates get enlarged for various medical reasons, it can make it hard to empty the bladder. It's not good to have urine sitting in the bladder because urine is very high in nutrients. We don't think about that, but it's super high in nutrients. That's why it's very smelly. Like if you walk on streets and you can tell that there's urine there because it's so high in nutrients that bacteria can grow very quickly. And enlarged prostates make it hard for someone to empty out their bladder, so urine stays there. And then bacteria love urine because it has a lot of nutrients in it. And then finally, people who hold their urine. One of the main population of people who hold their urine is children, especially when they're getting, when they're playing or whatever it is and they don't want to go to the bathroom. So this is why it's important with children, especially when they're young and they're learning to go to the bathroom, to not hold their urine. You don't want urine to stay. You want it to get flushed out because, again, it's a high nutrient environment for bacteria to grow in. And so when someone potentially has a UTI because maybe they're saying they have painful urination, so dysuria, you could assess through a urinalysis to see, do they potentially have a UTI. There's different ways to assess if they have a UTI. There's different screening procedures. A common screening procedure is using a urine dipstick. It's basically a stick that you stick in urine, and it tests for blood in the urine. You can look at pH level. Okay, we're going to start. You can look at blood in the urine. Blood in the urine is not a good thing because it indicates inflammation. It indicates infection. Red blood cells are called hematuria, and pyuria are white blood cells in the urine. Again, when you see a high amount of white blood cells, it means that someone is fighting the infection. And with hematuria, it means that there's red blood cells in the urine, maybe indicative of inflammation. So that's what the dipstick shows. Here's an unstained urine sample, and A good eye that's been trained can see white blood cells in there. You can also send a urine sample to look at it under the microscope, again, to look at bacterial growth and also blood. And hematuria is red blood cells in urine. Pyuria is white blood cells in urine. The way we quantify bacteria from urine samples is through counting colonies, and that's what you're going to do today. But I do want to mention two things. So urine culture, if you take someone's urine and it has less than 10,000 bacteria per 1 milliliter of urine, that's classified as insignificant bacteriuria, because it's just a normal microbiota, just normal bacteria. So that's not a very high number of bacteria. But if we see a urine culture with greater than 100,000 bacteria per milliliter, and that's by counting bacterial colonies, we know that that's a significant bacteriuria count, so that indicates infection. So if anyone, I think almost everyone is probably going to have this done in their lifetime, or a family member, if you get a urine, if you suspect that you may have a UTI and you go to the doctor and they do a urine test, they usually send you the results. The lab will always look at this count. It's always interesting to see how many colonies of bacteria they counted per milliliter. And so that is what we're focusing on in lab. So in lab, you're going to create 2 streak plates to quantify and initiate the diagnosis of a simulated UTI. You're going to have agar plates. You're going to use 2 different agar plates. One that's called sheep's blood agar, because it actually has sheep's blood in there, which kind of simulates what our body is like when bacteria grow in it. And then you're going to use another plate called Kaneki Agar. I'm going to talk about each, but on each plate, you're going to streak a sample and assume it was urine, as if someone had given you a urine sample. And that's what clinical microbiologists do. And then you're going to count colonies of bacteria, these little circles, and determine if the person potentially has an infection. So we're going to start by talking about the blood agar plate and then the Kaneki agar plate. So with a sheep's blood agar, this plate basically promotes growth of all bacteria. So you get gram-positive and gram-negative bacteria. And on this plate, what you would do is you're potentially given a urine sample. So if you can try to envision getting a urine sample, and you're going to streak it on the sheep's blood agar, which is red because it has blood on it. The streak method you're going to do is called semi-quantitative streak method. And how it works is you have your blood agar, you take your loop, it's a volumetric loop, meaning we know how much urine it holds. You dip it in the urine, and then you go down the agar plate, so as this image shows, and then you go across it like that, going down. And the idea is to spread out bacteria evenly, to dilute it slowly, so that you can count the number of bacteria for a quick diagnosis. So we use this plate to estimate the number of bacteria in 1 milliliter of a simulated urine sample. And after you put the urine on there, you incubate the plate. Then you come back the second day, and you're going to count the number of colonies, again, these little circles on the blood agar, and you're going to calculate the colony forming units, or number of colonies per milliliter, which is the number of viable bacteria per milliliter. And remember, this is significant in that if someone has over 100,000 bacteria per milliliter in their urine, you know they have an infection. This is the formula you do. You count the number of colonies and you divide it over a 0.01 milliliters. This number came from the volumetric loop that you guys cannot see, but that loop holds that much. And then for the other plate, you're going to do the same thing from the urine sample, but now you're going to take the urine and you're going to do the semi-quantitative streak method on an agar called Kaneki agar plates. Kaneki agar plates are selective and differential medium. It's a media, meaning what you grow your bacteria on. It's selective because only gram-negative bacteria can grow, because the plate has bile salts and crystal violet, which don't let gram-positive grow. So it selects only for gram-negative bacteria. So gram-positive bacteria will not grow on Kaneki agar. And it's differential because this plate differentiates lactose fermenters from non-lactose fermenters. So Remember, bacteria, some can ferment lactose, they can metabolize it, and some cannot. Lactose fermenters indicate coliforms, which are basically bacteria and feces, E. coli, different organisms. Non-lactose fermenters include Pseudomonas, Shigella, Salmonella, Proteus. And when lactose is fermented on Kaneki agar, you get a pink color. So if you grow bacteria on Kaneki agar and it's pink, you know that your bacteria are lactose fermenters. If it's white, colorless, they're non-lactose fermenters. And the reason why the lactose fermenters turn the agar pink, or the colonies turn pink, is because the agar has a pH indicator in it and lactose, and the pH indicator turns pink when there's acid produced. And remember that when a bacteria can ferment lactose, it produces acid. So that's the thinking behind the Kaneki agar plates. And you're doing semi-quantitative streak method here. You're counting colonies on this agar plate and recording pink colonies as positive for lactose fermentation and white colonies as negative. Now, the reason why we do the Kaneki agar plates with urine analysis tests is because it gives an idea with the proper prescription to give someone in regards to antibiotics, and you know what type of infection they have. So I want to start by saying that a UTI can be caused by both lactose fermenters and non-lactose fermenters, but most of them are caused by organisms that can ferment lactose, though both can cause UTI. So it gives you a better idea of what type of infection someone has. And so the objectives of this lab is for you guys to define cystitis, which is bladder infection, pyelonephritis. Pyelonephritis is when we have kidney infection. Dysuria is painful urination, and then pyuria and hematuria have to do with blood in the urine. So hematuria is red blood cells and pyuria is white blood cells in the urine. The two sources of urinary tract infections. So people can get urinary tract infections from their normal microbiota or from an infection that spreads to their kidneys. The risk factors that promote development of disease: you're more at risk to getting a UTI if you're a woman, if you have a catheter, if you hold urine in, you have enlarged prostate, different neurological disorders. The name of the medium used for counting bacteria. So the one that you used here, blood agar and Kaneki agar. So you take the person's urine and you streak it on blood agar and you streak it on Kaneki agar. The one that you use to count total bacteria is blood agar, because blood agar lets all bacteria grow, both gram-positive and gram-negative. You use Kaneki agar to select for those bacteria that are lactose fermenters. So the Kaneki agar is a differential medium because it differentiates lactose fermenters from non-lactose fermenters. Those that can ferment lactose give you pink colonies, and those that cannot are just white. And it's selective because it selects only for gram-negative bacteria. Gram-positive bacteria can't grow. The streak method you're going to use for both of these is the semi-quantitative streak method, where you take either agar plate and you take your urine sample, you streak down, and then you go across to be able to count colonies. And then you count the bacteria from the blood agar. That's where you use the formula CFU per 0.01 milliliters. So again, this is the blood agar for the urine sample, and this is the Kaneki agar. And I hope that you guys learned something about UTIs and have some understanding about the methods that are used and the differences between blood agar and Kaneki agar.